So let's start off with the basic anatomy of the tooth, and these are the supporting tissue that hold the tooth in our mouth. Such tissues are the gums, periodontal ligament, alveolar bone, and cementum. Gums is the soft tissues that surrounds and protects our teeth. Periodontal ligament is a group of tiny fibers that hold the tooth in place and act as a cushion when we chew. Alveolar bone is the part of the jawbone that hold the teeth. And lastly, the cementum is a thin layer that covering the root of the tooth. And now I'm going to explain what is periodontal health and diseases. To make it simple and easy to understand about periodontal health and disease, I'm going to use the house and foundation analogy. Think of your tooth like a house and your gums and bones as the foundation. In a healthy mouth, the soil, which is your gum, is firm, pink, and fits snugly around the tooth. There is a tiny shallow space between the gum and the tooth, but it's easy to keep it clean. Your pocket depth is only 1 to 3 millimeters, about the thickness of a coin. Let's see the first stage, which is gingivitis. Imagine if you stop sweeping the porch of the house, dust and dirt, which is the plaque, will start to pile up at the edge. This plaque will irritate the gums, making them red, puffy, and likely to bleed when you brush. The good news is gingivitis is reversible. The bone will still perfectly fine if we clean away the dirt. Now everything will goes back to normal. Moving on to the third stage, which is periodontitis. If the dirt isn't cleaned up, it turns into concrete, which is a calculus. Your body will see this as an invader and tries to fight it. Unfortunately, the bone will start to crumble in the process. The gums will start to pull away from the tooth, creating a deep pocket. This is where the bad bacteria will hide. You can't reach them with toothbrush anymore. As the pocket gets deeper, the bone that holding the tooth will melt away. Eventually, the tooth become loose and fall out. This is an OPG X-ray which shows the view of your entire mouth. In a healthy mouth, the bone should sit high up, close to where the crown of the tooth meets the roots. If you look at the gaps between your teeth on this X-ray, you can see that the bone level is lower than it should be. This is called bone loss. Because you have periodontitis, the bacteria in your pockets have caused your body to slowly dissolve the bone that hold your teeth. For example, you can see the red circle that I highlighted here. You can see shadows around the roots of your back teeth, especially at the furcation areas. Our chart shows deep pockets in these areas, which match the bone loss we see here. This X-ray was taken before you had your teeth extraction. You can still see those teeth in this image, but they were removed because the bone support was no longer enough to keep them healthy. To understand what's happening in your mouth, we have created this periodontal chart. Think of it as a map of the foundations of your teeth. The numbers you see in red are the pockets, the gaps between your tooth and the gum. While 1 to 3 millimeters is healthy, we see numbers like 8 and 10 millimeters on your back teeth. These are like deep basements where bacteria hide, where you can't reach them with a normal brush. The red blocks shows us exactly where your gums are bleeding. Bleeding is a sign of active infection. It's your body's way of telling us that the bacteria are causing damage right now. We also notice some slight looseness in a few teeth, like tooth 1, 6, and 2, 5. This happens because the infection has started to weaken the bone support. We also notice some slight looseness in a few teeth, like tooth 1, 6, and 2, 5. What can I say for the long-term outlook of your teeth based on this X-ray and charting that we have created? It is overall fair. The good news is that you are a non-smoker and your diabetes is relatively well controlled with an HbA1c of 6.8%. Your body has shown it can heal well as seen by your recent extractions, which is uneventful. However, some specific teeth are in a guarded or poor state, especially those back molars, where the infection has reached the area between the roots. Tooth 3, 5 also has significant attachment loss. The future of these teeth depend almost entirely on two things: keeping your plaque levels very low and keeping your blood sugar stable. If we can do that, we can stop the disease in its tracks. So now let's talk about the importance of plaque control. But first, let me explain to you, what is plaque? plaque is basically a sticky biofilm that is full of bacteria, and it usually adheres on our tooth surfaces. It is the main driver for the gum diseases. So since you are managing your diabetes, your body can be quite sensitive to the bacteria in this plaque. So it is important for us to remove the plaque every day, because at first, when the plaque is in its soft form, it is easy to remove it. But if we don't remove the plaque every day, it will eventually become harder and form calculus. So you must be asking and curious, what's the relationship between the formation of the calculus and bone loss? Let me explain it to you. So the formation of the calculus will be seen by our body defense system as something, as a foreign bodies, or in a simple way to put it, as an invader, something that should not be in our body. So our body defense system will send our good soldier to fight off all the bacteria at the calculus, but eventually throughout the process it will cause a collateral damage. The collateral damage that we are talking about is basically the bone loss in our jaw. Since we already talked about the importance of plaque control, let me introduce it to you, some of the stuff that we can use to help in managing our daily plaque control. So first of all, we have fluoridated toothpaste. This toothpaste contains a fluoride. Fluoride is very important since it has a very good antibacterial properties that can kill all the bad bacteria in our mouth, and it can also help to remineralize our teeth. Next, we have toothpick. So let me show it to you one of the toothpick that I have here. This toothpick is very soft. You can use it to remove the food that's stuck between your teeth, and it won't cause damage to your gums because it is very soft. Next, let's move on to the floss that we can usually find on our toiletries nowadays. So this is Oral-B floss, and you can see here this is the floss thread. You can use it to remove the food that's stuck between your teeth. Next, we have a soft bristle toothbrush. You can see the bristle is very soft. It is important for you to use the soft bristle toothbrush so you can reach the pocket between your teeth and gums, and it won't irritate your gums. Next, we have a single tufted toothbrush. This single tufted toothbrush usually we can use for example the area that is hard to reach, like the back of our mouth. Next is the tongue scraper. Other than taking care of our teeth, we need also to take care of our tongue hygiene, so we can use it to scrape off the debris on our tongue. And let's move on to the mouthwash. We have a fluoridated mouthwash. So as I explained before, the fluoride is very important in taking care of oral hygiene. And next we have a floss handle. So it's the same, it has floss thread, but it has handles so you can hold it easily. Next, we have interdental brush. I'm going to show you some of the interdental brush that I have here. So interdental brush comes with a lot of size. So you can try which size that can fit snugly between your teeth in order for you to remove the plaque between your teeth. Next, we have the most important component, which is the mirror. This mirror can help to ensure that you are performing your oral hygiene correctly. And now I'm going to teach you the correct way of brushing your teeth. This method is called modified base brushing techniques. So first, I'm going to show you. Imagine this is your mouth and your teeth. And first of all, pick up your soft bristle toothbrush. Remember to use soft bristle toothbrush so it won't damage your gums, and also it can easily reach into your pockets. So open your mouth. I'm going to show and demo it to you at the lower teeth. So I'm going to start for the front teeth at the front surfaces. So hold your toothbrush like this and angle your toothbrush 45 degrees. 45 degrees and making sure the toothbrush touch both surfaces of your teeth and also the gums. Your landmark should be the border between your teeth and also the gums. 45 degree, and brush away from the gum margin, so the plaque that is being accumulated in the pockets can be removed away from the pocket or away from the gum margins. And as for the inner part, you can hold your toothbrush like this and angle it 90 degree, or in a simple way, straight, and making sure that the toothbrush touch both surfaces of your teeth and your gum and brush away from the border so we can remove the plaque away from the pockets. And as for the back teeth, same, hold your toothbrush like this, angle it 45 degree, making sure it touch both the teeth and gum surfaces. Remember, your landmark should be the border between your teeth and your gums, and brush away from the gum margins, same as the inner part. Hold it 45 degrees and brush it away from the gum margins, making sure all the surfaces of the teeth and gum contact with the toothbrush. And as for the upper surfaces, or we call it occlusal surface, you can brush it like this, same as here. And since you have extraction of molars, you have already extracted the teeth here at the back of this teeth, and also this teeth. Imagine this teeth has been extracted. So like I explained earlier, you can use single tufted toothbrush for area that is hard to reach, for example at the back of your mouth. So hold it like this and feed it at the back of your teeth. Make sure that this bristle come into contact with the teeth at the most behind of your mouth, so we can clean all the plaque that's stuck there. Clean like this. Yep, make sure that the bristle come into contact with the teeth. Same as here also. Same for your upper teeth. And the most important place for the plaque to accumulate, other than the back of your mouth and also in the pockets, is also the gap between your teeth. So as you can see, there's a lot of gap in your teeth. So I mentioned before about interdental brush. So there's a lot of sizes for interdental brush, and you must be asking how to choose the correct size for choosing the interdental brush. So the way of choosing the correct interdental brush size is, first you start from the smaller size, feed it into the gap between your teeth. If it occurs there is no resistance or slight tuck back, that's not the correct size. But if you go a little bit bigger, and you find it to have some resistance, then that should be the correct size of your interdental brush. And it is important to have that slight resistance for you in order to remove the plaque that has been accumulated at the gap between your teeth. Now, moving on, I'm going to explain about the periodontal treatment that I am going to perform to you. So first, we are going to do plaque scoring. This involves applying a disclosing agent, which is a dye, to the teeth to highlight the areas of bacterial buildup. The percentage of tooth surfaces covered in plaque is calculated. The blue color is the old plaque, and the pink color indicates the new plaque. Next treatment involves supragingival scaling. This is the visible part of the cleaning process. The process will be using the ultrasonic or hand instruments, whereby the clinician will remove the plaque and hardened calculus from the surfaces of the teeth above the gum line. And lastly is subgingival scaling. The clinician will carefully cleanse the root surfaces below the gum line. This will remove deeply embedded bacteria and toxins from the root. The furcation focus will be the special attention is paid to teeth like 1-6 and 2-6 where the infection has reached the space between the roots. These areas require specialized instruments to clean effectively.